Hello there, my name is Sam Foley, this is Josue Martinez, and we are doing an Astran bicycle test today. Now, Josue runs 3 times a week for about 30 minutes or more, making him physically active. He does not have any signs or symptoms of metabolic disease or cardiovascular disease, so he has not been diagnosed with any of these disorders, and has been cleared to start exercise. Now, he's doing his warm-up right now, but beforehand, I took his resting vitals, and he is at a heart rate of 74 and a blood pressure of 102/65. Since these values are within normal ranges, it is safe to begin the test. We adjusted the bike seat to his greater trochanter, and for this 3-minute warm-up, we are starting at 25 watts of intensity, about 50 revolutions per minute. And since we're almost at 3 minutes here of this warm-up, I will take his heart rate and blood pressure to see if we can begin the test. Your heart rate. Excellent, thank you. Heart rate of 80 here. Blood pressure. Awesome. We had a blood pressure of 102/65. What's your rate of perceived exertion?
A 6.
Okay. Excellent. So now we can begin the test here. So at minute 2 of this test, we would increase the watts to give him into submax range, which is between 60 and 85% of his heart rate max. However, due to COVID, we have to stay at 25 watts. So as we approach minute 2 here, I will now take a heart rate sandwich, which is when I take the heart rate, the blood pressure, and then heart rate again. Heart rate at minute 2, blood pressure at 220, and then another heart rate at minute 3. So I'll begin that now. Heart rate. Awesome. And we were at heart rate of 8 beats per minute. Let's now go through blood pressure. Hold that for me, please. Now, you're at a blood pressure of 104/65. What is your rate of perceived exertion at the moment?
A 6.
6, excellent. So we'll take one more heart rate measurement. Excellent. All right, 82 beats per minute. Excellent. Now as he goes along here, at minute 5 of the test, I will repeat the heart rate sandwich again. If this heart rate is over 125 beats per minute, and both heart rate measurements are within 5 beats per minute of each other, it indicates steady state has been reached, and he can begin his cool down. If they were not within 5 beats per minute of each other, we would continue the test for another 2 minutes and retake measurements until steady state is reached. So I will now begin that as we approach minute 5 here. All right, first. Excellent. 4 beats per minute. Now I will take blood pressure once again. Excellent. Hold that forward, please. Set there. We have 106/66. What is your rate of perceived exertion at the moment?
A 6.
6. Excellent. Now one more heart rate measurement here. Now, we were at 84 beats per minute. So that is excellent. Now your heart rate measurements were within 5 beats of each other, so we now may begin the cool down phase. And because of COVID here, normally we'd put it back down to 25 watts, but instead I'll just have you pedal a little bit slower for me. And I'm going to, now that we're in the cool down phase, I'm going to take one more heart rate and blood pressure measurement after a minute, just to make sure that both the vital signs are responding correctly to this decreased intensity. So as we approach a minute here, I will take another measurement of heart rate and blood pressure. Start with heart rate once again. Amazing. 78 beats per minute, excellent. One more blood pressure measurement. Excellent. Just hang on to this for me, please. Thank you. All right, so blood pressure now is at 102/65. So both your heart rate and blood pressure have decreased. Now this is excellent news. So let's weigh your results. Right now, we're not accurate at normal one of these Astran cycle tests, since we have to adhere to COVID guidelines, because we couldn't get you into submax zone. However, if we could use that submax zone to calculate your VO2 max, and from these results we could help better prescribe your exercise. So nice job today.
Thank you, Sam.
Thank you.